Good afternoon. This is Dr. Harold Kaplan, the doctor for faces in Torrance, California. And I want to welcome you to our next webinar in a series of webinars we've been having on facial plastic and reconstructive surgery. Today's webinar is about beautiful silhouettes or profiles, and we're going to talk about noses, chins, ears, and necks. For those of you who don't know me, I grew up in Chicago, attended the University of Wisconsin for undergraduate, and returned to Chicago for medical school. I subsequently came to UCLA for 5 years of postgraduate surgical training, and over the years achieved the rank of Associate Professor of Surgery at UCLA. All the while, for well over 20 years, I directed resident physician training in facial plastic and reconstructive surgery at Harbor UCLA, while in private practice here in Torrance. I am board certified by two boards, the American Board of Facial Plastic and Reconstructive Surgery and the American Board of Head and Neck Surgery. Our in-office surgical facility is accredited by AAAHC, which is the largest accrediting organization for outpatient facilities in the United States, and I'm on the medical staff of the two local hospitals. So what are we going to cover today? Well, how can you make my profile or silhouette look better? How long are the different procedures? How old do I have to be to have my nose, chin, or ears done? And we'll get to that because there are differences. If I bring you a photo of a nose I like, can you give me that nose? I'll probably give you back the photo and I'll tell you some stories about that. Are there any non-surgical solutions to these problems? There are. What's the recovery time for these procedures? How long do the results last? How much do they cost? What are the risks and how safe are these procedures? And how do I find a reputable surgeon? So let's talk first about noses. Now, when we evaluate a face, we break it up into the upper third, the middle third, and the lower third. And right smack dab in the middle third is the nose. And if you look from above down, it's right in the middle. If you look left to right, it's right in the middle. So it is a dominant feature. And I tell all my patients that a good nose doesn't get noticed. Typically, a nose that gets noticed is detracting from an otherwise attractive face. So here we go. Somebody brings in a photo, and here's the Mrs. Snowman. I want one of those cute little baby carrots, and I'm sure she brought in a number of photos of various carrots. But here's a gentleman, and we're going to start talking about a procedure called rhinoplasty, or if we're also fixing the septum of the nose, it's called a septorhinoplasty. So on this front view, the before and after, you'd say not much change. That's true, because what he didn't like was the profile. He felt that he looked kind of tough and rough and wanted to not have that look. And we'll forgive the mutton chop sideburns, but I think he now looks a little less aggressive. Here's a woman, very attractive woman, who came in and said, I think my nose is very big. Well, actually, if you look, there's a little hint right there of a bump. But this is a circumstance that we call overprojection, where the nose pushes away from the face. And so all we did on her was take that area down subtly and set the nose back towards the face, which makes for a much softer looking appearance. And that's just a nose that doesn't detract. It just sits where it belongs. Now, I mentioned something about upper, middle, and lower third of the face. Well, there's a direct relationship between noses and chins, as the obvious dominant part of the middle third being the nose and the lower third being the chin. And there is a relationship, if you can envision, if you could take a doll and take a string and attach it through the back of the doll that pulls the chin forward, and if that line was attached to the back of the nose would retreat backwards. Likewise, if you pulled the nose forward, the chin would retreat backwards. So there is this direct relationship between those two structures. So here's a young woman that came in saying, oh, my nose is too big. Well, you could say she's got a little bump there, but if you drop a line from the upper lip through the lower lip, and if you keep going, that chin is recessed behind that line. So in her circumstance, we did what's called a rhinoplasty, but we also placed a chin implant so that that line drops down and gets much closer to where the chin is, and that softens the features and makes it more in harmony. Now, the face technically doesn't end at the chin. It drifts into the neck, and there is a relationship in angles between the chin, the lower jaw, and neck, and these can cause some significant issues for people as well. So here's a woman that came in saying, I've got a double chin. Well, there's a lot more going on here because, again, if you drop that line, that chin's recessed. There's a lot of jowl here. There indeed is problems with a fat pad here and weakness in the neck muscles. So in her circumstance, we've done a type of facelift that is focused on the lower third of the face and upper neck. We've also placed a chin implant, and you can see what happens from before to after. And we've also done some liposuction here and a muscle repair. And now the relationship between the lower third of her face and neck is much more normal. Another example, here's some things going on here. And you'll notice that by just doing that type of lower third facelift and neck lift with a little muscle repair here, that neck suddenly looks longer and thinner. And in most women, a long, thin neck is an attractive feature. Probably Audrey Hepburn was the ultimate one of that, although some people could criticize and say it was too long and too narrow, but it was still an attractive feature. Here's a woman that had a very insignificant problem, but here we just did some liposuction underneath the chin, and you can start to say, yeah, that neck definitely looks a little more elegant. Another example, now we're doing just a mini lift, so where we're just working this area, and now in the profile you can see by just doing some of that lift of the lower jawline and getting some liposuction accomplished here, look at this angle change. And that's a much more feminine, much more delicate looking neck. Another example of a facelift with a muscle repair, and you can see this banding goes into a much more direct line and makes that neck look much more gentle. Another one where the neck was definitely involved, and now you can see we've done that type of facelift and at the same time done muscle repair here and some liposuction. And that makes for just a much softer, much better angle where the neck and chin and jawline meet. It's not always women. Here's a guy. And he's got these bands here, and he's had a type of mini lift that just helped him in the jowl area and lower jaw. And then we did a muscle repair. Now in his profile, it would not be masculine to have a long, narrow neck. That's a positive feature in a woman, but it's not necessarily a positive in a man. So we've improved this area, but we weren't trying to get that lengthening image. One last one, I think, where we're talking about the type of mini lift where the jowls are here. There's this bad angle from chin to neck. And so what we've done here is we've done that mini lift, we've done some liposuction under here, and we've placed a chin implant. And here's that line dropping down, and here's that line dropping down. And now we're running into chin, which puts it in a much better balance. Most people wouldn't think of ears as something that has to do with a silhouette or a profile, but indeed, depending on the angle that somebody's being observed from, it can be a very, very dominant feature, and it can take over the appearance of a face. So here's a woman that all her life wore her hair down and long to cover ears that she felt protruded significantly. And indeed they do. This is a condition called congenital lop ear, and the ear sticks out from the skull, and it comes from in the embryo. a number of months into development, the ear is supposed to fold backwards on itself in a select number of people. That doesn't happen. So here she's undergone what we call an otoplasty, and now she's content to wear her hair up as much as she likes, and there's much more of a balance between an ear that stuck out before, and now it's much more parallel to the skull. And there's a subtle little incision right back here that the operation is done through. This photo I've always used because it was in the days where I had an autofocus camera. And as I tried to take this picture, the camera danced back and forth between his ears and his face. And now this is an attractive, handsome man, except this feature of ears protruding is really detracting from that otherwise handsome look. So here he is after an otoplasty, and it's not an ear pinning. There's no pinning going on. All we're doing is creating that natural rollback of the cartilage so that the ear becomes more parallel to the skull. So, are there non-surgical alternatives? Well, I've always said, buy a big hat, rakishly tilt it over your face, and you can hide just about anything. Bad solution to a lot of problems. You'd be owning a lot of hats. But there are some things that we can do with fillers. There's lots of uses of injectable fillers. But, for example, somebody comes in and says, oh, on my chin, my jawline are bothering me. Is there any way I could see what it would look like? Well, we can put some fillers into chins and along little notches in the lower jaw. And it works for maybe 6 months, at best 12 months. And it's an attempt to get an idea of what things would look like. I use fillers frequently, though. I'll do a lot of consultations on revision rhinoplasty, where noses are done elsewhere, and there's little problems. And then in the old days, that meant a return trip to the operating room. And I've been able to now do some revision work with fillers. You think of it as using putty and just blending in some indentations, or if there's a high-low spot that you could just make the angle blend a little bit. And in some of these instances, after you've done it once or twice, sometimes it'll last for a number of years. And it's just a nice alternative to returning to the operating room. I have seen ads for people saying they can do complete rhinoplasty via fillers. That's not really true. You can do some minor changes, but if you really have a nose that needs to be changed, surgery is the ultimate option. So let's get to some common questions. And who's a candidate for silhouette profile enhancing procedures? What age is it time to consider them? Well, let's go back to some of those photos of some of those middle-aged people. And it's not necessarily age-related. Once you see the problem, and if you're in good health, it's time to fix it. And the rule of thumb is the sooner you intervene, frequently the intervention is smaller, and the sooner you intervene in the problem, the longer the solution to that problem is going to last. So it's not necessarily at what age is it time to consider it in that group. Now, when we start talking about the rhinoplasties, facial bones mature after the adolescent growth spurt. So if you're seeing a child for a rhinoplasty, that is not appropriate because they have to go through that adolescent growth spurt. And usually I'll turn to parents and say, how many times has the shoe size changed? And if they say, oh no, the shoe size has been stable for a year, then it's time to consider that the bones of the feet and the facial bones tend to mature somewhat at the same time. Now, we know that the girls go through the adolescent growth spurt earlier than the boys, so typically a rhinoplasty in a girl, about 16 would be about as early as you go, occasionally sooner. The boys, it comes a little later, so more likely to be 17 or 18. Now, it's interesting, on ears when we talk about otoplasty. If you go by a schoolyard and watch kids playing, you'll see that the kids that are in kindergarten, they're playing with anybody. They don't recognize that you're different than me and vice versa. And it is interesting that psychologically at about age 7 or 8, children identify, oh, you have something different than I have. Well, at the age 6 to 7 is about when ear cartilage matures and can be operated on. So you can do a child who's in kindergarten, first grade, second grade, and do an otoplasty, and in many instances get them out of the schoolyard ridicule that unfortunately can occur. How long do these procedures take? Well, let's look at the rhinoplasty situation. Typically, it's about an hour and a half to do. If you're doing a chin with it, add another half hour. An otoplasty, most people it's both ears, but there are a handful of people that only have it in one ear, but typically if you're doing both ears, it's about an hour and a half. Now, if you're just doing a chin implant, it's about a half an hour. Some liposuction is about a half an hour. Now, those procedures that we showed where there's a lower facelift or neck lift or a mini lift and then some liposuction, etc., those procedures can take 2.5, sometimes up to 3 hours, depending on the combinations. The type of anesthesia used, virtually all of them, except if somebody's just doing some isolated liposuction, which can be done under a local anesthetic. But the rest are done under a type of anesthesia referred to as MAC, M-A-C, Monitored Anesthesia Care. What that means is there's a board-certified physician anesthesiologist who's doing the procedure. They start an IV and they use intravenous propofol in most instances. And it is a very safe form of anesthesia because you're asleep, unaware of anything, except you're still breathing on your own. So it doesn't require intubation and being placed on a ventilator like it does with a general anesthetic. So it's a very safe and reliable form of anesthesia. As far as recovery time is concerned, virtually all of these things, it's about a week. For example, rhinoplasty, I put a splint on. In a week, you come by, we take the splint off, and lo and behold, 75–80% of the result is present. Now, the remaining 20–25% of that result takes a number of months to finally materialize, but most people see quite a bit of result within that 1 week. With otoplasties, we have a bandage on for a week, it comes off, and then I have people wear a headband like the basketball players wear, mainly while they're sleeping, because rolling over on an ear that was just operated while you're sleeping can undo things. So it's a protective device. In terms of the recovery from liposuction, chin implants, all those other procedures I was showing, it's about that same 1 week. Now, how long do results last? Well, if you put a chin implant in, it lasts. If you do an otoplasty, it lasts. If you do a rhinoplasty and change a nose, it lasts, but it's very fascinating to watch noses because it's living tissue. We're not doing sculpting in plaster or in marble. It's living tissue, and if you watch people go from their teens, 20s, 30s, 40s, 50s, 60s, that nose continues to age. So it does change. But it's not the undoing of the result, it's the aging of normal tissue. The typical face, neck lift, and things like that, 7–10 years, and then the muscles start to sag again, and it might be time for a revision. Always get asked, how much do these things cost? I'm going to give you some examples, but as you saw earlier, there's a variety of combinations, and that gets to specifics. But for example, otoplasty, $3,400 for the surgery, $1,900 for the operating room, and a little over $600 for anesthesia. A rhinoplasty, $5,100, $1,900 for the operating room, and a little over $600 for anesthesia. A chin implant by itself is $2,000, and the operating room is only $800, and some of those can be done with just a little sedation, and we don't even need the anesthesiologist. A rhinoplasty with chin implant is $6,300, $1,900 for the operating room, and a little over $700 for anesthesia. If you're doing some liposuction or a muscle repair under the chin alone, it's $2,100 or $2,400, $800 for the operating room, and frequently there's no need for anesthesia other than a local anesthetic and a little bit of sedation. Mini lifts go up to $4,750 and $1,900 for the operating room, $600 plus for the anesthesiologist. A facelift, $7,500 plus $1,900 for the operating room, and a little over $600 for the anesthesiologist. And as I mentioned, some of these combinations vary. What are the risks? Well, fortunately, operating in the head and neck and doing these plastic and reconstructive procedures are usually in a much more superficial layer of the body. It's basically skin, superficial muscles, some fat. So the risk factors are pretty limited. In a rhinoplasty, you could get some bleeding, and I might have to put a little bit of packing in, although that's quite rare. For a chin implant, about once every 5 years, I'll have to take one out and replace it, or just take it out because it migrated, it shifted around. But it is a remarkably stable implant, and like I said, about every 5 years, one has an issue. With the facelifts and neck lifts, probably the most notable risk factor is a problem called hematoma, which is an accumulation of blood underneath the skin flaps, and that needs to be drained. Normally it's just something I do in the office, and it's quickly resolved. So in selecting the best surgeon for the procedure you're interested in, I think experience matters. I've had this long-term bias about the guy in the left upper hand corner, but I think we're striving for patient satisfaction, obviously, but can you have a 100% success rate? And the answer is nothing's that good, but the willingness to revise or tweak it and get you to that point where the satisfaction is there ultimately leads to a much better success rate. I think the training of the surgeon is really essential. Somebody like myself has spent 5 years operating solely in the head and neck and face, and when you compare that to somebody that spent 2 years of training and they're doing body work, breast work, facial work, hand work, that depth of training really adds up in the long term. Board certification. If you're in an office and that doctor, surgeon is not board certified by the appropriate boards of plastic surgery or head and neck surgery, you're taking a risk. That's a minimum standard that must be met. I take it further and say, if you teach, and I taught resident physicians at UCLA for over 20 years. These are gifted, talented surgeons in their 5th, 6th year of surgical training. And as you're teaching them, they're challenging you. And I think most people that teach will tell you the more you teach, the more you learn. So I found that in teaching others, I've acquired more and more knowledge. And I've been blessed and I'm humble over the years of having the respect of my peers, have doctors and their families, nurses and their families as patients. But at the end of the day, it's the integrity, honesty, and respect for you, the patient, that the surgeon has to exhibit. So we're going to get to some more questions that have been previously submitted. You have an opportunity to submit in the corner. And if we run out of time, I will shoot you an email as fast as possible. Again, I'll move to those in just a minute. So don't forget, if you've attended the webinar, you can schedule a complimentary consultation. And why not look great by Valentine's Day? And we still have some appointments available. So give us a call at 888-344-9805, or you can email Dara at thedoctorforfaces.com. And I would love to see you in the office and discuss with you your particular issues. And before we sign off, I've got these additional questions that have come up, and we'll talk about those. Again, this is Dr. Harold Kaplan, the Doctor for Faces in Torrance, California. So if you've got to get out, we'll see you soon. Some of the questions. First one, if I fix my nose, how do I know it will work the same? People with great voices don't change their noses. Should I be concerned? That's a very good question. Well, first of all, people that have been trained in the specialty that I have, which is all those years of training in and around just the head and neck, know very well the function of the nose, know the function of the throat. And these are you can do a cosmetic surgery, but if you sacrifice function for the form, you've created a new problem. And our goal is to solve the problem and not create another problem. And we can adequately take care of both the function and the form of the nose. This issue about people with great voices don't change their noses, I'm not so certain that that's truly the issue, but if you were a star performer, I'd give it some thought. Why is my chin receding and can I stop it? Well, if any of you have had a bone scan for osteoporosis, you would notice that they scan the spine, they scan the pelvis, they scan the hips, but they also scan the lower jaw. It is a sizable enough bone that as we age, it can lose bone density and it can recede. So at that point, the only option would be some form of chin implant to re-augment the chin. How does ear pinning work, and will it affect my hearing if I do it? Well, I mentioned earlier, we're not pinning the ear, we're just creating that fold back of the ear cartilage. And it's not ear surgery. There has no impact whatsoever on hearing. We're not working down the ear canal, we're not working anywhere near the middle ear or the inner ear. Another good question, will my neck waddle be gone completely, and how can I repair the skin exterior? Well, when we do these repairs, we're repairing the underlying muscle and tightening it, and sometimes also doing liposuction. And that does create a little redundancy of the skin, and we at the same time take care of that right then and there. So there's not something that you do later about that. I do also worry about the word gone completely. That implies perfection, and we're striving for a lot of improvement in making things better, but I sometimes caution people about saying, I want something gone completely. Sometimes that can lead to other issues. So a very pleasant result is what we're striving for. Solve problems, don't create new problems. Is there anything I can do about a double chin if I don't lose weight? Well, the answer is yes. You can do some liposuction, you can do a muscle repair, and it will look better underneath your chin. Obviously, if you keep gaining weight, you'll replace fat cells despite doing the liposuction. So there's an end point where you do have to take care of business. Here's another question similar. What is a waddle? Actually, a waddle is made up of several things. It's not just skin. It's not just fat. It is also a laxity and lack of integrity of the muscle layer under the chin that allows things to sag further. So when we repair a waddle, many times we're having to lift the muscle, tighten the muscle, suction the fat, and then also get rid of some of the excess skin. Can any skin cream tighten my neck or chin skin? The answer is some topicals can smooth things out a little bit, but at the end of the day, if something's hanging, there's no cream that's going to move it. When you fix my nose, can I get my eye bags done at the same time? And the answer is sure. We do all sorts of combinations of procedures. There's no reason why you couldn't do that. That's not an uncommon combination of procedures. Can you create cheekbones or more defined cheeks, and how? You notice that I had a presentation earlier about chin implants. Chin implants are remarkably reliable. They rarely cause any real trouble. And more importantly, there's only one chin. There's two cheeks. And now we have an issue of, can you have symmetry? What if one implant behaves better than another? So I'll often counsel people away from doing true surgical cheek implants and towards using injectable fillers for highlighting cheeks. Two of the reasons, well, the first reason being you can keep adding to it and you can do it in gradual steps. And the other reason is you can reverse it. And let's say you've done some injectable fillers and the person's not pleased with it. There's a reversal agent. So I like the flexibility, and I like the fact that with a cheek, if one side's doing a little better, you can cheat a little bit with the filler to one side more than the other, and that is very difficult to do with a true cheek implant. And I think that is all the questions that came through to me today. And if you've submitted one and we missed it, as I mentioned earlier, I promise we'll shoot you a quick email response. So don't forget to take advantage of the complimentary consultation, and thank you for sharing your lunchtime with me. Again, it's been my pleasure. I look forward to seeing you in the office. This is Dr. Harold Kaplan, the Doctor for Faces in Torrance, California. Good afternoon.